The size of the ovarian cyst actually tells us a lot about the risk at hand. Now remember, the ovaries itself is small like a walnut. So anything growing on it changes how the ovaries behave. Please pay attention. Let's talk about the sizes right now. The 0 to 3 centimeters. So cysts under 3 centimeters or cysts within 3 centimeters, they are considered follicles, meaning they are a part of your monthly cycles. So medically, these are considered physiological, not a disease. So most women, they actually have it and don't even know that they have it because they don't twist the ovaries, they don't rupture, and then also clinically there is no treatment really needed. Now think of these as normal body functions like your ovaries breathing. Let's talk about the next sizes. That is the 3 to 5 centimeters. Cysts between 3 to 5 centimeters are still considered small. Please understand that right now. Medically, they are often functional cysts. They usually shrink on their own. They rarely cause any emergency situation. So doctors, they usually just watch them with ultrasound. Very important. This size can cause some cramps. It's proven. It can also cause some pressure, but it is like having a small balloon sitting there, annoying, but also not dangerous. Pay attention. And then let's talk about the next side. That is the 5 to 7 centimeters. Now the ovary is starting to get stretched out. So medically, the risk of ovarian torsion slowly increases. The pain becomes more common. The doctors may monitor it every 6 to 12 weeks. And then some doctors will also recommend surgery if the symptoms get worse. So at this size, the cyst is big enough to bother you and then also big enough to flip the ovary if you move suddenly. Please pay attention. Now let's talk about the high risk. Let's talk about the dangerous risk, the 7 to 10 centimeters. Now this range needs attention. Medically, this is going to cause high risk of torsion, that is the painful twisting, higher risk of rupture, pressure on the bladder or bowel. Please pay attention. Also, more likely, you may need surgical removal. Now, this size can reduce blood flow to the ovaries. A lot of people don't even know. Doctors do not like leaving cysts this size alone. So this is like carrying a water balloon that can burst or twist. You don't want to ignore this particular size. Let's go to the fifth one. That is the very dangerous. Now this size needs intervention. It definitely needs intervention. The 10 centimeters and above. Anything 10 centimeters or bigger is considered large, and at this point the ovaries can't function normally. So medically, this has a very high torsion risk. Rupture can also cause internal bleeding. Now this is harder to tell benign versus complex cyst. So surgery is almost always recommended in these sizes. Now fertility can be affected if you ignore this particular size. So at this size, the cyst is basically taking over the ovaries and it must be evaluated, usually removed for safety. I want the best for you all the time. Please let me know the ovarian cyst size you have. We need to touch bases. Send me inbox, comment. Let's break situations down. Let's tackle the solutions together. My name is Neri Solomon. I'm going to wait for your comments. I'm going to wait for your DMs. Let's tackle this situation together. And I'm going to see you soon.